Knock, knock, can I come in?
Yes.
Hi, my name is Geneviève. I'm your nurse today. How you doing?
Good.
Okay. So, what is your name?
Quentin Belonga.
Okay, Quentin Bilunga. So how you want me to call you? Would like me to call Quentin?
Yeah.
Okay, Quentin. I'm gonna be doing the physical assessment on you today. It will be the respiratory system to check how your thorax, and then I'm gonna be doing the cardiovascular system, which is the heart. Is that okay with you?
Yes.
Okay, I'll go ahead and gather all my equipment here. Okay, I'll go ahead. Since my hands are not visible, so I'm gonna use the alcohol base. Okay, so I'll rub my hand for until the alcohol is dry. Okay, to make sure I took off the microbes. If there's something, but they are not so there's nothing to worry about. Thank you so much. So I'm gonna go ahead and provide some privacy. Okay. So are you comfortable where you are?
Yes.
Okay. So first I will start with I will ask you some question, okay? Just tell me what you feel at this time, okay?
Alright.
So Quentin, do you feel, I will start with the respiratory one. Do you feel any short of breath?
No.
Are you coughing?
No.
Any sputum?
No. No.
Okay, so I'm gonna go ahead and inspect, okay? I'll be inspecting your AP diameter, okay? So, okay, the ratio is 1 to 2, which is good, okay? And also now I'm gonna be inspecting your skin color. So, your skin color is nice, pink moss, normal for appropriate for the ethnicity, okay? And then for the skin too, I'm going to be checking for any dehydration. So I'm look at your lips and look at them if they are dry or moist. Your lips are dry and moist, so there's no sign of that dehydration, okay? So now I'm going to go ahead and I will auscultate, okay? So what I'm going to auscultate, I will start to auscultate the posterior chest wall, and I'll come to the anterior chest wall, and then I'll finish with the lateral one. So I'm going to use my stethoscope. So I will start with the posterior one. So lean forward for me. Can you turn this way? Okay. So I'll start here. While I'm doing this, okay, I want you to take a deep breath every time, okay?
Okay.
So I'll start with, go ahead, 1, go ahead, 2, go ahead, 3, ahead, 4, good, ahead, 5, ahead, 6, ahead, 7, ahead, 8, can you lean forward more? Ahead, 9, and then 10. Good. Then turn. Let me do the anterior one. Deep breath. 1. Deep breath. 2. Deep breath. I try to avoid the muscle of the skeleton. Deep breath. 4. Deep breath, 5, deep breath, 6, deep breath, 8, deep breath, 7, this one was 7, this breath, 8. Okay, and then I'm going to do the lateral one. Go ahead, deep breath, good. So your chest wall is like symmetric, okay? There's no shallow sound. I didn't hear any the breathing. What I'm saying, I didn't hear any shallow breathing, any you didn't do any effort to breathe, and like they are normal, okay? And they are symmetric from one to another. No cracker, no wheezing. And now we're gonna go ahead and do the cardiovascular one, okay? So the cardiovascular is for your heart. So I'm gonna ask you some questions again, and you're just gonna tell me what you think.
Okay.
Do you have any chest pain?
No.
Any palpitation?
No.
Okay, good. Now I'm gonna go ahead and inspect, okay? I'm inspecting for any visible pulsation. Okay, how your heart is, your chest is moving, okay? No visible pulsation. Then I'll go ahead and inspect for your skin color again, the characteristic of your skin. So when I look at it, your skin is normal. For the ethnicity, your skin is moist and dry, no sign of dehydration. And then this time I'm going to palpate, okay? What I'm palpating is what they call the PMI, so the patient maximal input, which is going to be here. Can you lean forward for me? Okay. Good. Now I'm going to go ahead and auscultate. One more time I use my stethoscope.
Okay.
But this time, don't just breathe normally. Okay?
Okay.
So I'm going to start with, can you lean forward for me? I'm going to start with the aortic valve closer because I want to hear the sound, okay? This is the aortic, which is S2. So I will start here. This is your left side, right? This is, which one is, so, which one is your left side?
Yes, sir.
Okay, so I'm going to start with your, this. So, now you don't breathe, okay? The aortic one, the S2. Then I'm going to go to the pulmonic one, the S2. And then I'm going to go down to the EPS one, okay? The EPS one is the third intercostal valve, okay? Intercostal space. Good. And then I'll go to the tricuspid here. And then the tricuspid is S1 too, closure. And then I'm going to go to the mitral one. Mitral, yeah. The mitral is always also the S1 valve closure. Then I'm going to go to check your apical pulse, okay? And I'm going to count it for 1 minute. We'll count it for 1 minute. Okay, so your pulse is normal, the normal from 60 to 100, and you are in the good range. So it's normal, your pulse is normal. So your S2 and S1 are closed simultaneously. Okay, there's no and they are symmetric. There is no sound of, I didn't hear any, and the S2 is normal sound, which is dub, lub, dub, lub, dub, okay? So there is really no sign of like, it's normal, the apical is normal, and the sound are normal too. They are simultaneous. The closure, the sound of the valve, they are closed simultaneously. So everything is very good. So thank you so much for letting me do this, and hopefully I will see you next time. I'll go ahead and wash my hand. Thank you so much for letting me do this. Bye.